Stephanie back with session 6, and the topic today we're going to discuss is how I got to the career, or how I chose the career that I'm in now, which I can honestly answer, I have no idea. So let me back the story up. After I graduated high school, I was unsure what I wanted to do when I grew up. Yep, that question that I was asking you in the last session, I had no idea. So I chose to go to a community college and get my 2-year associate's degree in science and arts. After that, I knew that I wanted to do something in like a health professions role, something more in a clinical role. Wasn't sure exactly what that looked like. And Grand Valley State University offered a health professions allied health sciences degree, which was a general knowledge degree that included biologies and chemistries, all that kind of stuff that I found interesting. So I finished with that bachelor's degree, and then I was still unsure what kind of job I was going to get with that. What was my career going to be? I was still a little up in the air. So I met with a counselor who was also one of my teachers, and he gave me some very good instructions based on some of my interests and things that were important to me in the healthcare field. So I went to school to finish with a master's in clinical research. Clinical research is near and dear to my heart. It's providing oncology patients with a last hope effort of a novel drug that might cure their cancer, or kiddos that are at Helen Voss that are struggling, who need a trial treatment drug to get them back on their feet. There's so many trial drugs out there, and volunteers who put their time and effort into making sure that those drugs are safe and effective. If you remember safe and effective, that was from our first session that I told you what my current role is. But we're still back about 10 years ago. So I got my master's, and then I started working at a not-for-profit hospital. Well, that was great, but I did not really like being in a clinical setting. I didn't like being at the hospital. It required more hours than what I had intended. And I ended up getting a role in phase 1 oncology unit where we did oncology phase 1 trials for novel drugs, new investigational drugs. So basically all of our patients had 6 months or so to live, and we were hoping that those novel drugs were kind of that last effort to cure them. Some of our drugs worked and some of them didn't, which that was a great experience for me. But I realized I wanted a little more focus, not on the clinical side as I had anticipated. I realized I wanted to do something more with the pharmaceutical side, with the drug side. And that's what pulled me to Perigo. So Perigo also has a prescription line, an RX line, where we manage most of our clinical trials, in which I am also a part of. So that's how I kind of, segued over into a pharmaceutical world from the clinical world. Now, that was not a straight line, right? We don't start at the base of the Christmas tree and walk right straight up to the star on top. It's important to understand, and I experienced this, if you guys have heard, it's important to understand that your career is not going to be a straight shot to where you want it to be, and it's okay if it changes. Because if I was in a straight shot to where I thought my career would be, I wouldn't have any idea. I'd still be going to school, you guys, because I didn't know. So it's okay to not know, or if you do, please understand that it's okay if things change. It's okay if you get segued off into, a different role that you might not have anticipated yourself to be in. So that said, I hope you have the best luck at identifying what you want to be when you grow up. And I hope that gives you some insight into how my career path has led me to where I'm at today, and how it still kind of plays a role in the things that are important to me, that safety and efficacy of drugs, and how it's important that people have the medications that they need, and how Perigo as a company is providing those to those people, and how I can be a part of that in my role is largely a part of that. All right, we'll talk again soon. Session 7's our last one. Thanks for listening, guys. Have a great day.